The New South Wales Premier has revealed his plan to get the state back on track as COVID cases rise and rapid antigen tests are in short supply. Jessica Maggio is in Sydney. Jessica, Dominic Perrottet says New South Wales is in a transition phase.
That's right, Danica. Essentially, the Premier has said there's no alternative to pushing through with the Omicron variant. He has said that New South Wales has reached the endemic phase, and essentially this is living with COVID, and the way forward will be a heavy reliance on rapid antigen tests. That is part of his plan to move alongside the virus. He's saying he's considering making them available for parents at schools and distributing them amongst schools and communities. He's also said that they could be made available at pharmacies for free with a voucher system similar to what was seen with those Dine and Discover vouchers. The Premier has also stated he's considering an economic support package as hundreds of thousands are struck out either with COVID or as close contacts. But the Premier will address National Cabinet tomorrow. He will discuss the fact that schools should start on day one of term one and that rapid antigen tests should be the main force behind that, but they're not readily available. In fact, they're becoming increasingly scarce. It's very hard for people to get their hands on them. So how he's going to actually do that and bring that into fruition is really unclear. At the moment, there's around 100 million rapid antigen tests that the New South Wales Premier has obtained, but they will be prioritised for critical staff in healthcare, education, also for vulnerable communities and social housing. But the opposition says that that's not enough and that should have been a plan that was organised months ago.
If you can get your hands on them, they cost between $10 and $20 for a family of 5. You're looking at $100 simply to test whether you've got COVID or not. So the New South Wales government is playing catch-up, but at the wrong time. And at the end of the day, these provisions and procedures should have been in place before the Omicron wave hit New South Wales. After all, the government was warned.
Jess, the live music industry has suffered another discreet setback.
That's right. Dr. Kerry Chant on Monday evening signed an amendment to the decision that was made by the Premier on Friday that singing and dancing would be banned at pubs, clubs, bars, any hospitality venues essentially, except weddings. The Premier was insistent that large gatherings and events would go ahead. Here's what he said on Friday.
Have a major event planned throughout January, continue as planned. There are no changes to any of those events. They are continuing as planned. Only in circumstances where New South Wales Health deems that event to be a high-risk event, then we will contact those organisers and work through the current COVID-safe plans with you.
Now, since that announcement, a revision has been signed by the Chief Health Officer saying that music festivals will also see singing and dancing banned, and that has already had ramifications across the industry, particularly after a tough couple of years. The Grapevine Gathering Music Festival at the Hunter Valley has fallen victim first. They've cancelled the event just 4 days before it was due to start on Saturday. Around 16,000 attendees were expected. They'll be offered full refunds for their tickets. Also, 1,400 staff are expected to be impacted, so certainly that is going to have an impact in days, weeks and months ahead. But essentially, the Premier has said that he's confident that 2022 will be a better year. It doesn't look so for the music industry so far. The numbers have also dropped for New South Wales, and that is posing a threat to the industries that are struggling at the moment. 34,759 cases have been reported from 134,000 tests. Now, that is a high testing number that we've not seen for a few days now. So it's a good indication that people are still going out and getting tested. That doesn't include rapid antigen tests in that result, just PCR tests. 2,242 cases are in hospital. That number slightly increasing. 175 are in ICU, also steadily rising. But there have been 21 deaths. It is the deadliest day of the pandemic for New South Wales, so authorities will be monitoring those numbers closely to determine whether any other restrictions will be implemented.